This is my student support system. Keep watching, keep learning.
Medication are the substances prescribed by the client's prescribing practitioner or physician to help in treatment, relief, or cure of the cause of the client's health, alteration or illness, or in the prevention of such alterations. Nurses play an important role in the administration of the drugs, education about the drugs, and evaluation of effectiveness of the prescribed medication. Medication administration requires specialized knowledge, judgment, and nursing skill based on the principles of pharmacology. That's why in nursing subjects we also study pharmacology. The focus of this lecture is to assist the nursing students in applying the principles of pharmacology in acquiring skills in the safe administration of medications. What is pharmacokinetics? The pharmacokinetics refers to the study of absorption, distribution, metabolism, and excretion of the drugs to determine the relationship between the dose of a drug and the drug's concentration in the blood and biological fluid. What is absorption of drug? The degree and rate of absorption or passage of a drug from the site of administration into the bloodstream depend on several factors such as the drug's physiochemical effects, its dose form, its route of administration, its interaction with other substances or other medicines or in the digestive system, and patient's various characteristics such as age and weight. Oral preparations such as tablets and capsule must first disintegrate into smaller particles for the gastric juices to dissolve them and prepare the drug for final absorption in small intestine. Drugs administered intramuscularly are absorbed through the muscles into bloodstream. Suppositories are absorbed through the mucous membrane into the blood. Intravenous drugs are immediately bioavailable because of their direct injection into the blood to produce a drug effect. And sublingual medications are absorbed more quickly than the subcutaneous injection. So different routes have their different absorption speed. Now distribution of the drug. Distribution refers to the movement of drug from the blood into various body fluids or tissues. The rate at which the drug reaches to the specific site of action is affected by blood flow, cell membranes permeability, and protein binding capacity of the medicine. Metabolism of the drug. The process of metabolism, also known as blood transformation, refers to the physical and chemical processing of the drug. In metabolism, the drug is inactivated and changed into water-soluble compound that can be excreted by the body after action. The liver is primary source of biotransformation or metabolism of the drug. Excretion. Excretion is the process in which the drugs are eliminated by the body. Factors that affect the kidney's ability to excrete the drug include maturity of the kidney, circulation, and disease. As kidney function decreases due to any disease, there can be accumulation of the drugs in our body which results in toxicity.
My student support system. Keep watching, keep learning.